Hi, my name is Karma Desai. I'm a bioengineering student at Northeastern University, and I am presenting a proposal on increasing the strength of absorbable sutures while retaining the integrity through altering the thickness of the suture, along with adding a polastomer or calcium stearate coating in vivo. This presentation, we will begin with the background. Absorbable sutures are used in nearly every surgical practice. This is a multi-billion-dollar growing industry. They are easy to work with. They reduce the rate of infection and require less inpatient time, which allows for doctors to reach more people. This is a linearly growing industry, and by 2030 will be at a $7.2 billion market. The problem with absorbable sutures is that they are weaker than non-absorbable or traditional sutures, which can lead to complications such as breakage or wound adhesions inside or on the body. When dealing with wound closure, surgeons have different techniques that they can use. This can range from using staples, glue, or sutures. Within sutures, you have absorbable or you have non-absorbable sutures. Both of these groups are divided into braided or monofilament sutures. This is the structure of the suture, whether it is a braided thread or a single thread. Each of these have their own pros and cons. Absorbable sutures are commonly used in facial lacerations, percutaneous closures, as well as internal wounds and surgical sites. Absorbable sutures begins with a filament silk. This can be made from polycaprolactone, polydioxanil, or polyglycolic acid, or even a combination of these materials. The next step involves degumming, next followed into braiding the suture material. This can be either a multifilament twisted, braided, or simply a monofilament. Lastly, the suture thread, are dunked inside a coating. These coatings include benefits of antimicrobial resistance, added knot security, ease of use, lubrication, as well as increased tensile strength. Next, we will talk about the state-of-the-art of absorbable sutures and the gap within the state-of-the-art. When dealing with wound closure and healing, absorbable sutures have many benefits. They can reduce the rate of infection, which comes from the coating mentioned earlier. They can provide an internal drug delivery system, which can be controlled by degradation time. This can also be personalized specific to injury, whether it is needed for sutures during surgery or even a superficial laceration. As seen to the graph on the right, different materials have slight variations in tensile strength, which is shown on the y-axis as it degrades over time, shown on the x-axis. The goal is to remove the need for traditional sutures, as traditional sutures will always require multiple clinical visits or even multiple surgeries if the suture is done inside the body, while absorbable sutures will simply degrade safely into the body on time. As we learn more about the materials, the sutures can begin to be personalized to injury or clinical need. We will now dive into the third section of this presentation into our threefold approach of this proposal. Our first aim looks at material strength and tension. Currently, sutures are made from synthetic polyglycolic acid or synthetic polylactic acid or synthetic polydioxanil. They can even be made from a natural material called catgut. The study begins by creating suture threads of a single material and combinations of two of the materials. These are then tested to conclude which material or combination of materials has the highest tensile strength and bending stiffness. Then, the highest strength suture threads will be tested with different diameters in monofilament and multifilament braided forms. Common monofilament diameter thicknesses range from 0.1 mm to 0.5 mm. These different thicknesses have different needs in the medical field, and they can be shown to the right side of the slide. I propose decreasing the diameter thickness to 0.015 mm, then braiding these three threads together to create a single multi-filament braided suture. This will retain the strength of a monofilament while increasing the pliability. This leads us into our next aim. Aim 2 compares the braided versus non-braided sutures. As mentioned earlier, braiding thinner threads retains the average thickness so that surgeons can easily implement sutures while increasing the pliability to increase ease of use for surgeons again. The thickness is proportional to degradation time, and so the thickness is very important to take into account. As mentioned earlier, I propose decreasing the monofilament suture into a 0.015 millimeters thread, then braiding them together. Degradation time is proportional to how thick the suture is. The thinner the suture is, the faster it will degrade inside the body. All of these factors are things that can be controlled by the manufacturing process of the suture. Our third aim looks at the coating that is added during the manufacturing process. Sutures are dipped into these specific coatings, and each one has their own pros and cons. Generally, coatings enhance performance and effectiveness of absorbable sutures by reducing tissue trauma, improving knot security, and preventing infection. Current coatings are polycaprolactone, polylactic acid, polyglycolic acid, glycolide, or calcium stearate, each one again with their own pros and cons. Coatings are added to the suture by dunking them into the solution. I propose either adding the coating before or after the suture threads are in their braided or unbraided forms. Again, aim 2 focused on whether braided or unbraided forms were stronger. Manufacturing process, whether it is beneficial to add the coating before or after the suture is braided. This again goes into degradation time and more. Current absorbable sutures are not as strong as they should be and can often lead to complications. Our first aim in improving these sutures looks at what combination of materials can create the strongest suture. Our second aim looks at how does braiding the suture threads affect structure, pliability, as well as degradation time. And lastly, our third aim looks at when in the manufacturing process sutures should be coated, before or after braiding and creating a multi-filament. Testing for this will be done in vitro, then in vivo. The next steps of this will dive further into the manufacturing process, for example, looking at extrusion temperatures. Thank you for your attention, and I'm happy to take your questions via my Canvas discussion thread.